Rheumatoid arthritis typically involves multiple joints, usually 5 or more, symmetrically, meaning the same joint groups on both sides of the body, like both hands for instance. Commonly affected joints are the small joints, like the metacarpal phalangeal joints and proximal interphalangeal joints of the hand, and the metatarsal phalangeal joints of the feet. As the disease worsens, it can start to affect large joints, like the shoulders, elbows, knees, and ankles. During flares, or sudden worsening of the disease, the affected joints get extremely swollen, warm, red, and painful. Over time, they become stiff, especially in the morning or after being inactive for a prolonged period of time. People with rheumatoid arthritis may develop specific deformities, usually of the metacarpal phalangeal joints of the hand, such as ulnar deviation of the fingers. Deformities are also common in the interphalangeal joints, such as the so-called boutonniere or buttonhole deformity. This occurs when the extensor tendon in the back of the finger splits and the head of the proximal phalanges pokes through, like a button through a buttonhole, causing flexion of the proximal interphalangeal joint and hyperextension of the distal interphalangeal joint. Another finger deformity is the swan neck deformity, which is the opposite. So there's hyperextension of the proximal interphalangeal joint and flexion of the distal interphalangeal joint. Now, in the knee joint, a one-way valve can form with fluid from the swollen knee filling the semimembranous bursa. When that happens, the synovial sac can get so swollen that it bulges posteriorly into the popliteal fossa, creating a synovial fluid-filled cyst called a Baker or popliteal cyst. Extra-articular manifestations include non-specific symptoms of inflammation, such as fever, low appetite, malaise, or muscle weakness. Organ-specific manifestations include rheumatoid nodules, or firm bumps of tissue, and these are most commonly found in the skin around pressure points, such as the elbows. More rarely, they can be found in the lungs, the heart, or the sclera of the eye. There's also an increased risk of atherosclerosis and therefore heart attack or stroke. There's also anemia, interstitial lung fibrosis, and pleural effusions, which can present as progressive shortness of breath. One particularly serious condition that's associated with rheumatoid arthritis is Felty syndrome, which is a triad of rheumatoid arthritis, splenomegaly, and granulocytopenia, and it can lead to life-threatening infections.